Thank you.
Member for Vancouver Kingsway.
Thank you, Madam Speaker. I am deeply honored to rise today to speak to Bill C-216, the Health-Based Approach to Substance Use Act. I would like to thank my colleague, the Honourable Member for Courtenay-Alberni, for introducing this legislation and for his tireless efforts to advance compassionate and evidence-based drug policy in this country. Madam Speaker, in the shadow of COVID-19, the overdose epidemic has rapidly worsened across Canada, and that's hard to believe that could have happened. In British Columbia, 2,224 people died from overdoses in 2021 alone. This represents the deadliest year on record in Canadian history and a 26% increase from 2020. December 2021 was also the deadliest month on record in British Columbia, with 215 people losing their lives that month alone from an opioid poisoned drug death. That's the equivalent of about 7 deaths per day. Across Canada, over 25,000 Canadians have lost their lives to the overdose epidemic in the last 6 years alone. Now, although COVID-19 has fueled this crisis, it did not create it. Decades of criminalization, a toxic, poisoned, illicit supply, and a lack of timely access to harm reduction, treatment, and recovery services have caused this ongoing catastrophe. Now, this Liberal government claims that its response to COVID-19 has been evidence-based and informed by science and by the advice of public health experts. It's time to apply that approach to Canada's other epidemic. It's time to treat substance use and addiction as the health issues they truly are. The legislation before this House today would do exactly that. The Health-Based Approach to Substance Use Act would comprehensively address Canada's overdose epidemic by the following. It will decriminalize personal drug possession. It will provide for record expungement. It will ensure a low-barrier access to regulated, safe supply. And it would expand access to harm reduction, treatment, and recovery services across Canada, while also focusing on prevention and education. Madam Speaker, decriminalization is one of those issues where I believe voters are far ahead of politicians. It is a policy area where public opinion more accurately reflects the empirical data than our laws do. That's because not a single community across Canada is untouched by addiction. Everyone has a mother, father, sister, brother, uncle, aunt, cousin, grandparent, partner, friend, neighbor, or coworker, or child, or maybe even themselves, who has struggled with problematic substance use or substance use disorder. Indeed, Canadians understand intuitively something that is critically important to acknowledge in this House tonight. Those who are suffering are not criminals. They are vulnerable people experiencing tremendous pain. In his years working in Vancouver's downtown east side, Dr. Gabor Mate, whom I consider to be an expert of global stature and a great Canadian, has found that childhood trauma and emotional pain lie at the root of addiction. Dr. Mate said this is not a war on drugs. This is a war on drug addicts. Addiction can never be understood if looked at through the lens of moralism and judgment. It's time as a society we ask not why the addiction, but instead, why the pain? Indeed, Madam Speaker, if we accept that pain and trauma are at the root of addiction, then criminalization can only be seen as cruel and counterproductive because it compounds the very problem it seeks to correct. Stigma, shame, and abuse are the core emotional issues of those suffering from substance use disorder, and criminalizing their behavior exacerbates and deepens that shame and stigma. This is obvious. Criminal sanctions are society's way of imposing maximum trauma on individuals. They get harassed by the police. They go through the indignity of arrest. They go into the very serious, intimidating context of a court. They go through a trial. They go to jail. This system is designed to impose the most serious pressure society can possibly impose. In other words, when we criminalize substance use, we re-traumatize people who are already struggling to cope with trauma. Moreover, decades of evidence have demonstrated that criminalization serves to keep people who use drugs away from prevention and early treatment. Health services, due to fear of being arrested, labeled, or outed. Criminalization also pushes people who use drugs to rely on an illicit and obviously toxic drug supply. Madam Speaker, if criminalizing drug use worked, we would have eliminated it years ago. But instead, we have spent billions of dollars, harmed millions of people, torn families and communities apart, ruined individuals' lives, and achieved nothing. It is said that the definition of insanity is doing the same thing over and over again while expecting a different result. Madam Speaker, if that's the case, decades of lawmakers in this House have been and are insane. Part 1 of this legislation would end Canada's war on drugs once and for all by striking the prohibition against personal possession from the Controlled Drugs and Substances Act. It would end the insanity of the war on drugs. Furthermore, Madam Speaker, criminal records amplify the harms of criminalization by exposing people who use drugs to ongoing discrimination and creating barriers to housing, gainful employment, travel, and community involvement. This in turn leads to further stigmatization and marginalization. The disproportionate impact of criminal records on racialized and Indigenous communities has also been well documented. That is why Part 2 of this legislation is so essential to a health-based approach to drug use, because it would ensure that criminal records from previous offenses related to personal possession are fully expunged so that someone doesn't carry stigmatization for the rest of their lives. Now, unlike this Liberal government's failed policy on cannabis pardons, the process outlined in this bill would provide for an automatic, cost-free, and complete deletion of records. Finally, Madam Speaker, Part 3 of this legislation would require the development and implementation of a comprehensive national strategy to address the harm caused by problematic substance use. It would get at the real cause of the deaths. This strategy would be developed in collaboration with key stakeholders, including advocacy organizations, frontline healthcare providers, and importantly, individuals with lived experience. It would address the root causes of problematic substance use, ensure access to safe, regulated supply, provide universal access to recovery, treatment and harm reduction services, and reduce the stigma associated with substance use. There is an urgent need for low-barrier access to a safe supply of pharmaceutical-grade alternatives to illegal street drugs of all types for everyone now. Given that the main driver of the overdose crisis is the fact that the illicit poison drug supply is toxic and unpredictable, experts have been clear that the death toll cannot be abated without this evidence-based measure. Although limited access to safe supply has been provided in some jurisdictions, existing programs do not come anywhere even close to meeting demand across this country. To emphasize, it is the toxic poison street supply of drugs run by criminalized manufacturers with no regulation that is killing Canadians by the thousands. Any law that does not address this is not health-based. It is contributing to fatalities. Now, some in this government say they believe in treating addiction as a health issue, not a criminal one. I have heard 3 consecutive Liberal health ministers and a Liberal Prime Minister say this many times, but they refuse to act on this claim. The Controlled Drugs and Substances Act is the law that criminalizes drug use and addiction, and it's a federal law. I am calling on every member of this House, especially Liberals, and I'm calling them on that contradiction tonight, because this is a contradiction that kills. You cannot say you treat drug use and addiction as a health issue and leave it criminalized on the federal books to continue to kill people. Madam Speaker, I hope all parliamentarians stop the insanity and let's start treating drug use and addiction as a health issue that it really is. Thank you.